Vote yes on 1 for more treatment and safer communities.
We're focusing on your medical questions today on Ask the Expert. Dr. George Darah is here with answers to some of your questions. Well, hey, let's start off with my 6-year-old. Somebody's writing in here, is allergic to peanuts. What precautions should this person take during Halloween?
Sure, this certainly can be stressful for parents of children with peanut allergies, especially during Halloween. The key would be to take precautionary measures. Now, have your son wear a costume with gloves to protect him from contact reaction. Make sure he does not snack on any treats before coming home. Read the ingredient label of every piece of candy and do not let him eat it if there's no label. Make sure his allergy medicine accompanies him wherever he goes, and carry some hand wipes just in case of accidental contact with peanuts. Should focus on the treats that are safe for him to eat rather than what he cannot eat. Many children don't care so much about the treats as they do about wearing a cool Halloween costume and other Halloween traditions.
So maybe wear one with gloves.
Exactly.
All right. I have another question here. I have a small lump on the top of my wrist. Someone told me this could be a ganglion cyst. What could have caused this?
Sure. Now, ganglion cyst is a swelling on the top of a joint or covering of a tendon. Inside the cyst is a thick, jelly-like material. They most commonly occur on the back of the hand or the wrist joint. Now, their cause is unknown. Some theories suggest that small tears in the tendon membrane or joint capsule allow the contents to bulge out. Now, these cysts may or may not be painful. Joint motion may increase the pain, and many cysts can disappear without any treatment. However, you should follow up with your primary care provider to have this evaluated, even if you don't have any symptoms, to confirm the diagnosis and decide the best course of treatment.
All right, we have time for one final question here. I'm a 45-year-old male in good health. My blood pressures have been averaging 124/82. Would this be considered elevated?
Yes, the new American Heart Association guidelines consider blood pressures of 120/80 and above as elevated. Now, blood pressures of 130/80 and above is considered stage 1 hypertension. The elevated blood pressure and hypertension are associated with an increased risk of cardiovascular and kidney disease. Now, these risks are influenced by being overweight or obese, diet, alcohol intake, fitness level, and genetics. Now, this caller should continue to eat a healthy diet, limit their salt intake, maintain a healthy weight, and stay active and avoid smoking. Certainly, you also need to keep monitoring his blood pressure at home and follow up with his primary care provider.
All right, Dr. Darah, some good advice there. Thanks very much. We appreciate it. And next time on Ask the Expert, that will be tomorrow. We're going to take your legal questions so you can email them to us in advance. Dr. Darah is not going to answer them, but neither am I. But you can send them to news@13abc.com.
All right, thank you. And if you are worrying about bringing your e-reader to the beach, Amazon might have a solution.
How it's making changes to its Kindle product to make them more